And joining me now with the latest on COVID-19 in our area is our Medical Officer of Health, Dr. Paul Roumeliotis. Welcome back, Doctor.
Good to be back.
Now, Doctor, Cornwall hadn't seen a case in a couple of weeks. We've now seen two since last week, one on Friday and one announced yesterday. So we'll start and talk about those two cases.
Yes, the Friday case was really an individual who went and got tested because that individual was worried, had no contact, really had been sort of self-isolated for a couple of months, and got tested. And tested positive with no symptoms, and we're still trying to identify, where that individual got in contact with COVID, but we're not able to. We've looked at the contacts. We haven't been able to trace it anywhere, so we presume it's a community acquired one. The second one was a case of an individual that actually works in Ottawa at a long-term care facility, and so there was a contact there, and who developed symptoms and tested that individual, and obviously that individual lives in Cornwall, and so we're in the process of doing all of our contact tracing, and that is exactly what we should be doing whenever we get a case. Even though we get a case, once in a while, our goal is to identify the case, call the case right away, get in contact with the case. That's what contact tracing is all about. Ascertain where that individual has been, who that individual has been in contact with, isolate those individuals and/or test those individuals. And that's what we mean by contact tracing, contact case management, and confinement containing the infection. And that's what we're going to be doing moving forward as we've opened into stage 2.
And as we move into stage 2, obviously this is just a reminder that COVID is still around. The good news is I believe it's 123 of our 151 cases are resolved, but there are still 2 active cases in Cornwall, 4 in SD&G, something like 28 in Prescott Russell. So it's still here. And as we continue to open up, vigilance and proper social distancing, hand washing are of the utmost importance.
Very important, particularly as we start doing more activities outdoors, and the gatherings have gone up, and some of the malls are opening and restaurant patios are opening. So it's very important for us, although it's good news that we're progressing. Again, we're not out of the woods 100%, but it does look good. We want to maintain looking good. In terms of, if we get the odd case here and there, that's fine, but we don't want people to go out and spread it. We don't want the cases to start, accumulating again. So it's quite important for us to, again, understand that we still need to hand wash, we still need to do social distancing, and in contexts and situations where you cannot physically distance, you should be wearing a face covering, a cloth mask.
All right. So as we alluded to, as of yesterday, the province of Ontario did announce that stage 2 will be beginning for regional health units that were deemed that could enter that stage. That includes our Eastern Ontario Health Unit. So as of Friday, June 12th at midnight, we will be entering stage 2. So let's talk a little bit about what that means for our area.
Yes, first of all, I was very happy to see that the stage 2 really was all over the eastern part of Ontario, all the way east from Durham. So it really, outside of Durham to us, including Ottawa, we're all going to be in stage 2, which is very good. That'll eliminate the discrepancy. For example, I was worried that one area would be closed, and one area would be stuck in stage 1, and one would be in stage 2, and you'd have people going back and forth. But that's not the case. So all our area, including our neighboring health units, including Ottawa, are going to go into stage 2 at the same time. So that's a good thing. And so we'll be seeing, openings of malls right now. Restaurants can now and bars can actually open, but only outdoor, only the patios for now. Pools, wading pools, splash pads are going to open as well. We're also going to be seeing, for example, places of worship. Churches are going to be allowed to open and have mass and celebrations, but only at 30% capacity. And that is provincial, that's across the board. The churches will be open across the board, whether we're in stage 1 or stage 2. As you know, stage 1, the people who are stayed in stage 1 are really the Toronto area, because that's where most cases are. The other thing that's changed provincially, regardless of stage 1 or stage 2, is that the number of people that can gather together is 10 right now. So it's gone up from 5 to 10.
All right, and we know that the number of 5 caused a lot of confusion. So maybe you could elaborate a little bit more on the gathering of 10 and what exactly that means for social gatherings for people.
What that means is that individuals can be together, 10 people, but physically distancing. And so for example, that would be, going outside to somebody's lawn outside and physically distancing, because you're not from the same household, but you need to physically distance. So go to a park and sit around lawn chairs. You'll be 8-10 people. That's fine. What we're saying at this point is, however, you can have 10 people at your house. At this point, I know it's confusing, but there will be some changes made. We'll be able to have families mix, but if you're from the same household, that's not an issue. But again, the 10 people, again, I know it's confusing, but you can go, visit somebody. Don't go into their house, for example, but just visit them outside. And you can gather with 10 people, or you can gather with 10 people, at the park, for example, that type of thing. But again, physically distancing, if you're not from the same household. Again, there'll be some changes to that, and we'll be back to explain that more. Likely, the next time I come on, we'll have those changes implemented, where what we call the family bubbles, or people that can mix socially. But I don't want to complicate it. For now, you can go out and get together with 10 people, outdoors, but in a public setting. But obviously, physically distance if you're not from the same household.
Excellent. And just finally, Doctor, we know that the news from the health unit last week about beaches and farmers markets, so maybe we could just finish off with a quick note on those two things, which some have reopened and some will be reopening.
Yeah, beaches are now slowly reopening. We're testing them. We've provided guidelines to the municipalities and the authorities that operate them. Again, social distancing and all the precautions to be taken in place. And farmers markets as well. They are allowed to operate. Again, depending on the method of sale, they can do curbside pickup, or they can do a modified approach. And again, we've been working with them. We have guidelines on our website to be able to guide them so they can take advantage of the summer months, which is really their only window of opportunity.
Absolutely. And on that note, Doctor, thank you so much for joining me for this update.
No problem.